they allowed me to come in as a part-time basis and try to expedite information. I think that's a huge takeaway from this conversation that we'll highlight again, but that leadership at our county level, I just can't say enough about that, because obviously they invested in their citizens and their business and their schools and their kids and their families. So I wanted to mention that. I'm gonna just jump then into, so the thing that other school districts were doing, as Tonya mentioned, was waiting for DPI, waiting for the CDC, waiting for the Department of Health at the state level, and that was really frustrating for all of us. That was
I was gonna say, we had our plan written and implemented, and then DPI came out with it a couple weeks later, and I remember my school board president saying, wow, that plan looks a lot like our plan. And we were like, yes, like, we didn't have time to wait.
Yeah, so that was really great. We moved into the fall, and as Tonya said, the Lake Mills School District did open face-to-face to a lot of controversy, like I'm sure lots of people can attest to around the state. And the communication continued, but I stepped aside as that liaison because the systems were in place, and that's always had been my goal, is to have a system in place for these continued meetings, for really quick communication with Samroz and with the rest of the health department, and those systems were in place. So I stepped aside, but this kind of emotional thing was lingering in my head. How can we engage the community? Because I had heard that, and I had heard the impassioned speeches across our county, across our schools. Community, what are you willing to do? So I called my friend at CAPE, which is our Citizen Advocates for Public Education in Lake Mills, and I just kind of laid it out, like, is there something we can do? And I also met with the head of the Teachers Association in Lake Mills and said the same thing. How can we engage our community? All the other communities are asking for this, but let's do it. How do we engage our community? And that's when Sandy walks into the story.
Yeah. So as Pam has mentioned, when she became the liaison between schools and the Jefferson County Health Department, she contacted me about being involved in a community campaign. So last September, we sat under a maple tree in my front yard, and Pam already had a really good visual in mind and some goals in mind, and we formed a planning team, and then developed, as you can see on the table in front of you, our campaign. Our campaign goal was to keep COVID out of our community, and we knew that it would take a community effort. One of CAPE's goals is to advocate for our students, and it was just a perfect fit, because what better way to advocate for our students and our teachers than to protect their health and keep them safe. Our message was the 3 W's: wash your hands, watch your distance, wear a face covering. And our audience was the entire Lake Mills community. So we developed a logo, which you can see on our sign. We had signs printed, we had buttons made, we had pens produced, and we had our first activity as part of our fall festival. And maybe you can go to the next slide, Tonya, or can you go to the next slide, Samroz? Let's see where we are. Oh, there we are, and that's the first one there, okay. And we went to fall festival, and can you go to the next one too, Samroz? There's our logo with our 3 W's, and then the next one. Okay, and you'll see the parts of our campaign. So first of all, we went to Fall Festival last year, and we invited people to sign a big poster that said, I support the 3 W's. We invited people to take that pledge, take a pen along with you and have your photo taken. That was the start of beginning this community campaign. Initially, we thought that we would run the campaign through Citizen Advocates for Public Education, but we determined that it needed to be a separate entity of its own. We developed our own Facebook page, and we developed our own communication system. Our planning team has actually Pam and myself. We had 2 CAPE board members, we had 2 high school students, and 4 community members who are part of that team. So we knew once we launched our campaign, and we made the community aware of it, we were looking for a way to get our businesses involved. And we wrote a grant, and again, this was mostly through Pam's ideas and suggestions. We wrote a grant for our Lakes Mills Community Foundation for $1,250. We also received money from our local Optimist group and from the Greater Lake Mills Arts Alliance. There were a number of groups that wanted to support us, and so they were willing to donate money so that we could purchase gift certificates from local businesses and award those gift certificates in daily drawings. So our planning team members visited the local businesses, all of them on our list from our local Chamber of Commerce, in addition to new businesses that we learned about through this endeavor, and asked them if they wanted to join the campaign, and if they would make a commitment that their employees would wear a mask, they would promote social distancing, and they would also wash their hands. We welcomed them into our campaign, and we received so much positive support. Businesses said, thank you, we need to be doing this. We want to keep our community safe, and not only do we want our schools open, we want our businesses to be able to stay open. We were very pleased with the response that we got from our business community. Now, not all businesses wanted to join. That was their choice. We had told businesses when we invited them to join that we would be publishing a list in our local Lake Mills Leader when the campaign was finished. And we did receive a comment from one of the businesses questioning whether we should do that because that would be publicly shaming the businesses that did not join. Well, it was our belief that we had told businesses that up front, and we needed to follow through with that commitment. And the list was so long that when it was published in the Lake Mills Leader, that we did not feel that it was publicly shaming anyone. We also got a few calls from people who would go into businesses when they would see our sign, and they would not have their expectations met because not all of the employees were wearing masks or following some of the protocol. We never wanted to be in the business of being the COVID police. We were just encouraging our community to support what we knew would keep them safe. In all told, up on this slide, I'm not sure, we awarded about 70 gift certificates, and we were able to give back almost $2,000 to the community. And one thing that was really nice about our campaign was that we didn't go to businesses and say, would you like to contribute $25? Our businesses in small towns get hit with those kinds of requests all the time. So we had community sponsorship of the funds, and so we were able to purchase the gift certificates because the community was backing us and making it possible for us to do that. We had great coverage in our local Lake Mills Leader. I've cut out a few articles from there that I have up here. Pam and I were able to attend our the Rotary Club meeting and talk about what we had been doing. We had great support from them. We actually were interviewed on Channel 15 out of Madison and got some really great TV coverage. I mean, our hope being that we would keep our schools and our communities safe. So for our phase one was education. Our next one was to engage the business and our community members. And then phase three was, now it's time to get the vaccine. It's available. If you get the vaccine, it's another way to keep our community safe and our schools open. So we've shared a lot of information on our Facebook page. We have probably about 600 followers, lots of good informational articles. We use informational articles that are fact-based and you can be research checked. We are very careful about that. And we have featured pictures of people who received the vaccine if they wanted to share that with us to post on our Facebook page. And we also had many of our people who are part of our planning team who either volunteered at the vaccine clinic that was held in Jefferson or filled out cards, right, Peg? So that the work that was behind the scenes work that could be done at home. What will phase 4 look like? There's definitely a phase 4 as we move into a new school year. We don't know what that will look like yet, but we will stick to our commitment to keep our schools open, our businesses open, and keep our communities safe. And any way that we can work with our local school district, with people in our community, and with people in our county to make that happen will continue to be a priority.
I just want to back up to the vaccine clinic portion of that, because that was another huge benefit of having Samroz and Pam as part of this process, because as you looked around the different counties, you know, like I said, with being so close to Dane County, what we had as superintendents was, you know, we were allowed to have the rollout, I think it was like the 1A phase, where we were able to have, you know, special ed teachers, counselors, psychs, a select group that also had dual roles in the hospital system. Well, as we got word of that, we were sending, in Lake Mills, we were sending people actually over here to Sun Prairie to the SSM clinic for those vaccines. And that's when I got on the phone with Samroz. We talked about like, hey, like I know at that time we kind of heard about vaccines being thrown away because once things were open, they needed, and I said, if there is even like 3 vaccines that are extra, I've got a list of staff that are willing to be vaccinated. We'll do sub-coverage during the day. I will get them over to Jefferson, which was only maybe a 5-10 minute drive. And I think, Samroz, you kind of kicked it into action with Pam at that time, and then that's when you created the vaccine clinic over in Jefferson.
Yeah, that was, it feels so long ago now, but it was really only, what, past 6 months. You know, early on, of course, it was, you know, those who are 65 and older and healthcare workers. Luckily, you know, for the first, I think, several months, we never wasted a single dose at Jefferson County Health Department or any of our clinics. Once we had moved through the majority of, once we had vaccinated all of the interested healthcare workers and those who were 65 and older, there were a couple times where we knew we were going to have extra vaccine because we didn't have any more healthcare workers or folks over 65 to vaccinate. And so we reached out to our school districts and our schools and asked them to give me, you know, we asked for a list of staff, and even though at that time school staff weren't all eligible to get the vaccine, we tried to get a good start on that early on so that later on when teachers were approved to get vaccine, it was a much easier process. I would say at that time, about half of interested and eligible school staff were already vaccinated at that time, which was just really helpful. And I think being able to get the ball rolling early, I think instilled confidence in the school staff. Hopefully it instilled confidence in the school staff that the health department took our schools very seriously and in-person learning very seriously. You know, not only were our frequent meetings with our school administrators a testament to that, but we really tried to walk the walk and do whatever we could to make sure that in-person learning was occurring safely and that our students and our school staff were kept as safe as possible given what was going on. You know, we had extremely high case rates through January, you know, compared to right now. You know, until about last week, we were having, you know, from the end of April until about 2 weeks ago, we had 1 to 2 cases a day. But, you know, I would say from, you know, last September through most of January, we were confirming anywhere between 35 to 100 cases in a single day. So just a world of difference between where we are now. But I think it was you could kind of see that light at the end of the tunnel, right, when folks started to get vaccinated, because that level of stress just, I mean, it almost dissipated to some extent, right? And so it was I think a great success that we were able to get the ball rolling early.
It was kind of fun because we'd get the word from you, you know, and you're like, hey, tomorrow or 2 days from now, we think we're going to have 16 vaccines ready to go for you. And we would be like on the weekends and at night, like rearranging subs and doing coverage, notifying people, like get ready to go, and getting people out during the school day. And it was ironically about that same time that our girls and boys basketball teams were in regional sectionals and both went to state. So our Saturdays and Sundays were taken up with my executive assistant planning not only basketball, but vaccine clinics. So that happened to be our Sunday afternoons for for several weeks in a row.
I wanted to add a couple of things. Well, our Facebook page also became a resource for people who were in the community, and we actually received a message in January on our Facebook page from someone who was meeting a friend in Lake Mills, and they wondered if there were restaurants in Lake Mills following the COVID guidelines. And I was able to give them the names of all of the restaurants that had joined our campaign. It was really great to think that we were a resource that could provide that kind of information. And we also gave businesses recognition twice. We made sure that their picture was posted holding the sign when they first joined the campaign. And then when their gift certificate was awarded, we posted the name of the person who received it along with the business owner. And another business owner contacted us about possibly providing some kind of gift or incentive for getting the vaccine. We chose not to do that through the coalition, but she individually did something in her business where if you brought in your vaccine card showing that you had received the vaccine, you could get a small gift from her business, which I think all of those things came together because we had this coalition that people were aware of and knew that they could work with us through that.
So as long as we're talking about vaccines, I hopped back into the story then at the end of January, I think it was again on a Sunday. The health department said, do you want to come back to work for us, and would you run our vaccine clinics? Be part of the, I was in charge of getting volunteers and securing materials and kind of doing that. And because we were so well connected, we were able to run our vaccine clinic. I think probably our biggest day was about 1,400 people. We had typically 50 people in the morning at our vaccine clinics and 50 in the afternoon, and probably 40 to 45 of those were volunteers. But because we were established, we just used all of our resources, and we could very, very quickly use volunteers to man that. And I know that our county executive was getting messages from other counties like, how are you doing this so fast? How are you getting these people? And I think that, you know, having a really good foundation and a communication system really expedited the work that we did in vaccines. One thing I want Tonya to speak to is with the Keep COVID Out campaign, how did that help you in the school setting?
Well, I didn't feel like I was on an island as the superintendent. I mean, I really felt I had the support of the community. It wasn't like the schools were doing one thing or expecting, you know, masking and things like that, but then everywhere else you went in the community, that wasn't the case. What we saw in the school district, as many of you probably can guess, is, I mean, with our mitigation practices, we didn't see the spread of COVID from one student to another. What we saw was the activities of kids and families outside of school on the weekends and at night. So, and that's where, you know, we saw more through friends and family members. But the fact that I felt like, I mean, I've had several conversations with a lot of the business owners, especially the owner of the grocery store in Lake Mills. And I mean, they were going through much of the same things that I was going through as far as, you know, the hate emails or people in your face or, you know, not wanting to wear a mask and having to kick people out of places. And I just felt like it wasn't just me, that the whole community was supporting us. Everybody was going through the same thing, and just that tremendous support for the school with you know, the businesses. I just felt, you know, personally, that helped me as I had to go through and make really tough decisions. But it also showed me that the community was really committed to also having that in-person instruction too, which I felt we navigated very well. Yes, we quarantined quite a few students out of the utmost of caution, but at the same time, we only fully closed the district for about a week, not quite a week, at the end of October, and then our elementary school, we shifted to virtual right before Christmas break. But once again, that was the benefit of having Samroz, who is looking just specifically at our local data, and we did that when we saw a number of cases that we couldn't account for in contact tracing. We didn't know where it was coming from, and then out of caution. So I felt like Pam had alluded earlier that having those firm numbers of when we needed to shift to virtual, as we got into that, we did move away from that because I did have Samroz to lean on as far as internal data, like what are you specifically seeing with the families in Lake Mills? Can I keep the doors open, even though countywide and statewide we're seeing these specific numbers? So he was able to really track specifically Lake Mills numbers, so we were able to stay open as much as possible.
So
I'll jump in a little bit here to just speak to, comparing, early on versus later on. Earlier on, there weren't athletic activities occurring, so we really weren't seeing any sort of unsafe behaviors occurring in school, and we saw very, very little spread, honestly. In that early time when athletic activities weren't occurring, I would say we only had maybe 5 to 6 documented cases of in-school transmission, and that was when kids were maybe taking off their masks for a little bit and talking to each other during recess or something like that. Later on, when athletic activities started up again, we saw a lot more spread happening, in locker rooms and in the gym, when folks maybe weren't as careful about wearing their masks. But again, it was, back to Tonya's point, it was really useful to be able to tailor our approach for each school, right? We had our guidance, our recommendations as far as, at which thresholds, this number of cases within a school would necessitate, closing a building for a period of time. And luckily, we only had to do that in very, very rare circumstances. And I think it was incredibly successful in that we were able to keep in-person learning occurring for as long as we did and as consistently as we did, as Tonya alluded to.
I'd like to give all of you in the audience a few minutes. We've been doing a lot of sharing and talking right now, but would love to hear any questions or comments that you have or anything we can do to be helpful. Jim?
I think it was Jim Bowman. It may have been you, Sandy. You remarked that the local Rotary Club joined in the campaign at some level. I'm interested in any detail you might have on what exactly the Rotary Club did or what they committed to. Rotary's known, I'm a member of Rotary in my town. They're known as being quite cautious. And so when they sign on to something, it's significant. So I'm interested in exactly what they committed to.
Ma'am, you can answer that.
Well, Tonya and I are both in Rotary, so we can speak to this.
Yeah.
Rotary stayed virtual for a long time. And then we offered and continue to offer a Zoom option or in person. So one thing that Rotary did, they were already in person when we went to speak to them, but they chose a venue that was brand new, that had excellent HVAC. They chose to have the meals, because did we have meals right away? We had meals right away, but they were obviously individual. They had enough tables, so all of us in the beginning were kind of at one table that chose to go there. And then as things started getting better, and one of the doctors in Rotary was really kind of a leader for our county, so he would keep people apprised of information at each Rotary meeting. And as things were looking better and better, more and more people started to come. And I just talked to somebody this last weekend who said that we probably have the largest Rotary meetings right now than we've ever had, because we continue to offer a great space. People are spread out, and continue those, and individualized meals rather than a buffet. But people are just very cautious, and we have had no spread or no cases related to Rotary. So I know our Rotarians are talking to other Rotary clubs around the state about, you can do this. I mean, until last week, but.
I was going to say that to add on and also answer your question, at Rotary is obviously made up of business owners across the community. So as they rolled out the Keep COVID Out campaign, and Pam and I were in attendance, weekly at Rotary, I think, just having that, because I know we were in person at least from June on. I went to a June meeting when I started in the school district with you, so they were already back in person. But it was being able to have that access to the Rotary members, but I also knew that they were all part of the Keep COVID Out campaign. So, they were so supportive of the school district, and did they, I know when you presented, they usually make a donation as well, so I was assuming that Rotary donated?
No, Not that I'm aware of, no.
Okay.
And part of that, I would also say the Optimists, I'm on that board as well, and the Optimists, whose sole purpose is to support kids, they signed on right away too, and they made funds available, and there came a point where we had too much money, because not only did we have the grant, but people were making donations,
Yes.
and then sometimes when we would go to businesses, they'd give us another gift certificate besides
Right.
the one that we bought, and then money was coming in actually from another community member, someone from another community.
Yes.
Because she really liked what we were doing.
Yes.
And so when Rotary and Optimist asked if we wanted any more money, we kind of said, oh, we're okay. That's weird. But now we'll see in phase 4 where we
Right.
go.
Right. And we also reached out to churches. Early on, we started with these organizations, like the ones we've talked about. And we reached out to those of us who are part of local congregations and talked with our church leaders, church pastors, and all of them were very receptive because they were all dealing with how can we worship together in a safe way. So including both businesses or organizations and then businesses was key. Yes.
Yes, looks like you've done a great job of building this collaborative team to make this thing rolling, which is excellent. Kudos to you. Just knowing what you do now, because I think this, this thing is a moving target, but knowing what you know now, what do each of you think of your plans for the fall? I mean, if you were to make some kinds of decisions or predictions today, what would that look like, just for the comfort of this room?
We're all
last
going.
week I thought one way, and now this.
Do you mean with regard to our plan for safe learning in person?
Yes, I mean with learning in person, with all of the, political fist fighting we've got going on, just with the whole environment, because we know that's very difficult. And as Tonya said very clearly, you're at kind of a meeting point there in Jefferson County. But regardless of all of that, how are you going to approach in-class, face-to-face instruction, your staff, different technicalities of this? Where would you be today? What does that look like?
So I'm meeting with the admin team on Wednesday, and we had that in place prior, where we were going to, go through our plans. Originally, we were thinking we were going back without face masks because the vaccine had been available. We were gonna really specifically talk about what does that look like for the students 12 and under, do we just require face masks at that age, do we cohort? So really now, with all the news that came out last week, I think everything is back up in the air. We have a meeting scheduled with Samroz, I think this Friday again. And so I feel different though. I mean, I feel more confident going into this school year. Last school year, you were worried that somebody was going to die, be hospitalized and things like that. I feel like we know more so how things work, how mitigation practices work. I mean, last year at this time, we were afraid to touch surfaces. Our whole plan was built around disinfection and don't touch this and don't touch that till we found out, really what was going on more with the airborne transmission. So really, I really almost can't answer that question. I think, we'll meet this week and then we'll meet with Samroz. We'll see, once again, a benefit of having him. He'll be meeting with all the Jefferson County superintendents, and then we'll listen to see what he has to say. I think part of this plan just needs to go in with not a one-size-fits-all. I think once again, we need to look at our data at the different levels. What are the mitigation practices look like at those levels? And if conditions get better, or if the vaccine rolls out for the 12 and under, or as we find new information, we need to change things up. Last year when we went in with the face mask requirement, and then, it was overturned right at spring break, we stuck with it till the end of the year. We weren't willing to make any wide sweeping changes when we knew what we were doing was working at that time. I think, I'm kind of talking for you, Samroz, but I think things are evolving probably pretty quickly at this point. So I think we'll be kind of rolling in with I'm in my mind thinking communicating to parents just because we're going into the school year with this plan doesn't mean this isn't going to change 6 weeks or 2 months or 3 months into the school year as things change, in the county.
Absolutely. I think it's, I'll meet with the school administrators on Friday, and I'll let them know what the current science is, what the guidance from CDC and the Wisconsin Department of Health Services is, and we'll issue our own recommendations. And, some of the school districts need to go through a board approval process, and, depending on how that goes for certain schools, we may work on a more tailored plan that makes in-person learning as safe as possible, because that is the objective. As Tonya said, we know what works now, right? Where we're not going to spend time and resources necessarily sanitizing each surface several times a day. We're going to focus on making sure that if there's cases occurring, if there's a large number of cases, if there's a large number of active infections in the community at a given time, we act accordingly. If we're only having one or two cases within the county per day, that is a whole different risk level. So we'll talk more on Friday, and we'll see what folks are thinking and where the communities are at, and we'll go from there.
I would say, in terms of the coalition, our role will continue to be our focus on keeping our students and our staff safe and keeping our schools open for in-person learning. So whatever we can do to support the school board's decisions, we will be there to do that. We will continue to provide information on our Facebook page, as well as, if we can, through our local newspaper, to keep people informed with, so that they understand why the decisions that are being made are being made. We may come up with a really fun kind of campaign that we'll try to do again this fall, in terms of some kind of raffle or whatever. We haven't gotten nearly that far yet, because this is evolving so quickly.
So the posters that you see on your table, those signs, those were the idea of someone in our community, a business owner, when we said, what can we do to support you? And he's like, if you could have a visual, like on our front door. And he wanted us to say, like, we gave our blessing to that business. And that is not the truth. But we wanted to give people a visual. And the colors were picked very purposefully. And the message is very generic. And so when the mask kind of dropped and all those things were happening, I thought, oh, everybody's going to take down the signs. They didn't.
No,
because
they
the
didn't.
sign says this business follows the recommendations. And those businesses have kept those up. So I think that we need to continue to stay in communication with businesses about what the recommendations are, and that'll be part of our process as well. I am no longer working with the vaccine clinics as of June, when the clinics shifted into schools, and they shifted into a more targeted kind of process. What's that called, Samroz, where you went to the Jefferson County Fair, and you went to the airport.
Yeah, like we were doing the outreach.
Mobile
we're
clinics.
doing like community vaccination, mobile clinics, mobile vaccination. Really trying to meet the community where they're at, make sure that we are present in the community to answer questions, provide reliable, factual information about the benefits of getting the COVID-19 vaccine. Of course, information, as I mentioned before, is changing sometimes, based on what CDC found last week. We're now having to switch up our messaging a little bit and let folks know how that's going to impact, going forward, our policies and our recommendations. But really, we're trying to meet the community where they are at and provide information that they're seeking, so that we can empower individuals to make the best decision for themselves.
So in terms of my hope for moving forward, I would love to get a call from the county who says, hey, everybody wants to get vaccinated. Can you come and help us set up vaccine clinics again? That would be my little optimistic hope for the future. One other thing that I wanted to mention was that, I'm not sure if Sandy explained this, but for the raffle, when we had that for those months around the holidays and into January, we actually had community members go on our Facebook page and sign up that they commit to the 3 W's.
Right.
And that's how they got their name into the daily drawing. And one thing I wanted to mention about Rotary, or any of the organizations that signed up to work with us, they committed that their members would follow the 3 Ws. So that was how organizations supported us as well.
Any other questions or comments?
Well, we always want you to walk away with something, right? So on your handout, you will see what we call lessons learned, what we've learned. And I think we have a few minutes, right?
Mhm, we do.
So I'll just kind of read through these and just jump in, people, as you have comments to add to this. So one of the messages, and I hope that you heard this and you see this over and over again, is that we need to have open lines of communication. And we certainly see that in Jefferson County between schools and the health department. And we've closed that gap, that communication gap between the health department and school districts. And as somebody, I worked in schools for 35 years, I talked to health department once in a while if there was an emergency or something was going on. I happened to work in school districts that did not have county health nurses in our schools. We'd always contracted with another, with a hospital or something. So those lines of communication were not there for me as a school employee. So one of the things that we really wanted to work on is that communication. And of course I'm biased because I watched it develop, but I hope you feel
I was just laughing because I've got Samroz's cell phone number, so I can text him anytime, day or night, and I was just remembering, I think you called me in the middle of the girls' state basketball tournament, I'm like, Samroz is calling me. But it was like Pam said, when you needed an answer now because something is going on, he was just so responsive. So that communication, the fact that I can talk with either of you two, at any time, but yeah, everybody was really responsive. It was better than trying to email the, county or the health department, waiting for an email back. It was just, as things were happening in January, February, March, that was very comforting.
So the reason that I proposed this sectional is because I learned so much in the last year. And one of the things, and I tell anybody that I talk to, I give the same message, is that I had a perception about the health department. I thought that maybe we sent kids to the health department if they didn't have insurance or they needed some extra resources or something was an emergency or having stepped into working with the health department, I am so incredibly impressed and I keep saying optimistic about the future of the world. The people that I worked with on the vaccine committee and the nurses and the leadership of our county health department are outstanding. They are tireless, they are really smart, they are data-driven, they're systems thinkers, and when I was working with them, I was the old lady. I was the mom, or the grandma, right, Samroz? And I would have to say to these people, you need to take a breath. You guys need to take a break. I mean, these health department people have been working, they knew about this stuff back in, November, December, January. They've been geared up even before schools were. And when I was working with these people, I think the earliest in the morning I was texting with somebody was 3:30 as we were getting ready for a vaccine clinic, and I think until 11:30 at night. These health department people literally were working around the clock to just make sure that things were happening. So when we talk about gaps, I think my respect for the health department, and like I said, my optimism for the future of these leaders who are going to keep us safe for years and years to come, that gap for me has closed. I am so impressed, and I just cannot say enough about the health department and what they bring to the table. So with that, I think the lessons learned is that Samroz is incredibly intentional, transparent, as are all the leadership, and I think my experience with the school districts is that the leaders there were vulnerable and willing to talk about their fears and talk about the information that they needed. And so that is a huge opening to great communication when people can really be honest with each other. And I will tell you that when we were having these meetings with the superintendents and all the private schools, it got a little dicey because some of those private schools were saying, we're opening. Like, maybe your public schools, if you don't open, maybe your public, maybe your students will come to our schools. I mean, it got a little tense at moments, and especially in certain districts. But that mutual respect and that open communication, I think we weathered that and got through that very, very well. I have said this before, but I am incredibly impressed with our county executive and his foresight and his, I would say, unintrusive leadership. Samroz, I don't know if you can attest to that, but you have to have great leaders if you want to get great work done, and I think we have that in Jefferson County.
Absolutely. I think one of the most empowering things